According to the American Association for Marriage and Family Therapy, elderly individuals make up only 12% of the population, but 18% of suicides. The rate of suicide increases after the age of 85 and may be unreported by as much as 40% or more. An age where people are living longer than before and experience a lower quality of life, elderly people should be able to decide how they die. Today we will discuss first, life expectancy problems, next, assisted suicide, and finally, ethical dilemmas. Much of the information I'm going to be sharing with you today came from EBSCO host, Advanced Solutions International, ACSH, AAMFT, and the BMB. Living longer allows for more chances for things to go wrong and for the quality of life to lessen with each passing year. According to research done by McMaster University, to expand life, you must delay health problems and significant health problems. However, health problems are a defining feature of getting older. As we age, not only do people around us begin to die, but there is natural or cellular damage. There are also problems of strong hereditary diseases. Diseases and problems such as dementia, depression, hearing loss, loss of independence, eyesight loss, diabetes, obesity, heart complications, cancer, terminal illnesses, and so on. The British Medical Bulletin defines quality of life as the value assigned to the duration of life as modified by the impairments, functional states, perceptions, and social opportunities that are influenced by disease, injury, treatment, or policy. With all of these chronic problems for the undetermined amount of time, many elderly people find themselves wanting to die on their own terms. The American Council on Science and Health questions if assisted suicide is different from declining treatments such as chemo for aggressive cancer after many unsuccessful trials. Assisted suicide is a form of dying that is aided by someone else. According to the ACSH, assisted suicide is currently legal in a few places around the world, but generally only for those who have fatal disease or unrelenting pain, including the suffering that can come with aging. The AAMFT notes that suicide in the elderly population is not always in the same manner as younger ones. They have a higher rate of completing the act, but in gruesome ways. Also, unlike younger populations, they are often in a situation that will not get better. Assisted suicide provides a safe environment and humane way to end your life without the need for extra pain, such as in the cases of drowning, hanging, starvation, and if done wrong, gunshot wounds. People believe assisted suicide is a selfish act, but in actuality, the person is asking for the pain and burdening to stop. A big ethical dilemma of assisted suicide is that doctors, psychologists, and psychiatrists are charged with protecting human life, but they also believe in autonomy. According to Michael Gordon's article on ethical challenges and end-of-life therapies in the elderly, physicians follow guidelines to understand the impacts that their decisions have. One of the biggest facts of life is that everyone dies. Sometimes hard decisions need to be made, but under the rule of autonomy, just because a decision can be hard for a physician to understand, it is by full right of a patient to do so as they will with their treatment, medical decisions, and life. I would personally feel more comfortable having someone die under medical supervision than to have several failed attempts at home, like in the case of botanist David Goodall, who said this before his death in 2018 at the age of 104. My abilities and eyesight are declining, and I no longer want to live this way. I hope something positive will come out of my story and other countries will adopt a more liberal view of assisted suicide. I am happy to have this opportunity. I just wish Australia gave me this possibility, but other countries lag behind Switzerland. Up until the age of 90, I was enjoying life, but not now. It has passed me by, and I have done the best I can with it. Today we have discussed first, life expectancy problems, second, assisted suicide, and finally, ethical dilemmas. When thinking about giving someone the right to assisted suicide, we must ask ourselves if it's right to force someone else to live a life of pain and suffering just because of the pain it will bring us if they die.